New patient, new introduction. Okay, just because I introduce myself to the first patient of my day doesn't mean that counts for the next 10 or 15 that come in. Every time I have a new patient, I need to introduce myself, confirm their identity, and explain what it is that I want to do. Okay? And so, I believe that you are Patrick, is that correct?
Correct.
Okay, I see your name tag. And I am Dr. Shaker. I am your instructor for PTA 104. And we're going to continue our journey learning the bony landmarks of the upper and lower extremity. And so we're going to do that by palpating. I'm going to use my hands to find and examine the landmarks that you guys just looked at on your papers and on the skeleton. Okay? It does involve me putting my hands on you. Okay? And do I have your permission?
Yes.
It shouldn't hurt, but if we find something that's tender, let me know.
Okay.
Now, it is COVID-19 times, okay? And things are not necessarily the way they usually are, okay? If we did not have to worry about a virus, you guys would be palpating on skin, all right? When you're practicing at home, I need you to palpate on skin because the clothing obscures what we're really trying to feel and find, okay? Now, if Patrick is a good sport, do you mind taking your t-shirt off?
Sure.
Okay. And if you don't mind doing the same when you're practicing, I'm just not going to require it. During your practical in 2 weeks, if you forget to ask me to take my sweatshirt off or whatever, that will be a deduction. Because if I did that in the clinic, the deduction would be I might miss something that I should be examining with my patient. Okay? So yes, palpation is examined by touch, but also want to back up with my eyes. Okay? So I appreciate it.
Sure.
All right. So I would be behind you, but then again, I'll block the video. Okay? So I'm going to stand off to the side. Something that I did not emphasize in the other, I did it, but I didn't say that I did it. 2 hands, always. Okay? Even if I only need one hand to feel the other landmark, okay, I want to use my other hand to provide counter pressure. Okay, does that make sense? Because when I do something like this, with 2 hands on, I think Patrick feels a lot more confident that I know what I'm doing, versus if I just come along here and start poking around. That doesn't feel like I know what I'm doing. Okay? This first unit is about you developing skill. These are easy landmarks to find. That's not what I'm really testing you on. I'm testing you on whether or not you're practicing. Okay? So understand that. Finding the landmark is worth 1 point. The skill at which you do it is worth 3 points. Okay? So do understand that. And you guys got a little bit of work to do to impress me, because so far not so much. Okay, I need you to practice. Okay? All right. So, occipital protuberances. Okay? Now again, this time I'm going to do a little bit more than just find them. I want to get information about them. So if you were a patient, I might say, Patrick, is that sensitive at all? Okay? Do you feel me touching you okay? But again, for now, find them. Come to the middle. You're on the spinous processes. Now the Physio-U video for T1 was a little bit different. I'm going to show you 2 things. Okay? If Patrick puts his chin to chest, C7 is going to become prominent. Okay? And then if I slide one down, I'm on T1. Okay? Now the way that the Physio-U video showed it, go ahead, look forward. okay, is if I feel like I'm somewhere in the T1 area, I'm going to push his rib cage posterior, and I'm going to feel the prominence be moved, okay? You can do it either way, you just have to be accurate, okay? You might find the most easiest way is come down, I think I'm on the prominent vertebrae, chin to chest, and then it's going to poke out in your finger. And then go ahead, back up, and it goes away, okay? All right. Now we want to look at the scapula, posterior scapula, okay? And can you put your hand behind your back? If you do that, the inferior angle usually pops right into your finger. I'm going to feel up the medial border. I'm going to go over to the spine of the scapula, and the lateral projection is the acromion, okay? Now, I could have felt your acromion from the front, clavicle over. I should end up in the same spot, whether I come from the front or the back, okay? So again, relax, sit up nice and straight for me. Put your hand behind your back, relax. Can y'all see his inferior angle pop out? Yeah. And again, I'm going to just put a little pressure here, up the medial border, over to the spine. If I go too far, I'm on top of the scapula. That's soft tissue. Come back over to the acromion. Okay? You got it? Inferior angle over this way. What border am I on?
Axillary.
I'm either on the lateral, or if I want to be brave, axillary. Okay? Say it out loud. 12 times and then you're golden. Okay? Can you put your arm down by your side? Perfect. I'm going to slide down until I feel palm forward, anatomical. Okay? I'm on the medial and lateral epicondyle. How can I confirm that I'm on there? I can ask Patrick to bend his elbow a couple times, and I can look to see where the crease is, so I make sure I'm superior to it. Okay? Lateral epicondyle, medial. Okay? If he bends his elbow, this projection, anybody remember what that is? The olecranon. Okay? And then I can slide down his ulna. And Jules, what are these here?
The styloid process.
Okay, and which one am I on?
That one you slid down.
Okay, so I went lateral, so that's radial.
Radius.
If I had stayed on the ulnar border,
Yes.
I would be on the medial styloid or ulnar styloid. Okay, we good? Make a fist for me, and I see the knuckles. You need to number them 1 through 5. Number 1 is the thumb, and number 5 is the pinky. Okay, so it's the pinky would be the most medial metacarpal head. And then the only other thing that we didn't palpate is the head of the radius. Okay? So there's a little divot. Can y'all see the little divot lateral to the olecranon? Can y'all see that? I'm probably on the head of his radius. Okay? But I'm going to have him turn his palm, and now I feel the radial head spinning under my finger. Okay? Got it? All right, your turn. Thank you, sir.
You're welcome.